Hi, I'm Dr. Daniel Meyerkort from Perth Orthopaedic and Sports Medicine, and today we're going to be talking about bilateral knee replacement, or should you have both knees done at the same time. So, we do see patients where both knees are affected similarly. They come into my office and they say, "Doc, both knees are sore," often rubbing both knees. X-rays often look fairly similar, and I'll say, "Which is the more sore knee?" And they say, "It doesn't matter. Maybe one day the left is more sore, maybe one day the right knee is more sore." Many of these patients are going to eventually have both of their knees replaced. The question is, should you have them done one at a time, or should you have both done bilateral? I do bilateral knee replacement, and so a few tips or points for patients that may be suitable. Firstly, you've got to want to do both at once. So if you're prepared to do both at once, you understand the first 2 to 3 weeks is going to be harder, but then you only have to do it once. I'm more than happy to consider it. If you're not prepared to, or if you want to do them in a single staged manner, then that is obviously the more preferable treatment to recommend. So to be suitable to have both knees done at once, in my practice, I like patients to be under 70 years of age. I like them to be in overall good health. So this means no prior heart attacks, no significant respiratory issues, no significant issues or history with bleeding or clotting. In terms of weight, I like you to be close to your optimal weight. But certainly if your BMI is heading above 35 to 40, I would strongly again recommend you to do one knee at a time. We know that if we do both at once, there is a slightly higher risk of medical complications. When I say medical complications, I mean issues like heart attack, pneumonia, stroke, cardiac abnormalities or arrhythmias, blood clot in the legs, which is DVT, or in the lungs, which is pulmonary embolism. All of these risks are very slightly higher than if we do knee replacements one at a time. The other thing that many patients consider is if they're working and how much time they need to take off work. So again, if you're retired in your 70s, you may do one knee this year and one knee next year, and that is almost certainly going to be the safest way for you to do it. If, however, you're 62 and you want to take 1 6-week lot of leave, then again, that is another consideration that we may look at when considering whether to do one or both knees at the same time. So in summary, bilateral knee replacement is a good option for patients that want to do it, are relatively young, and are in good overall health. But if you're not in that category, or if you want to do them one at a time, that is still the safest way to undergo knee replacement surgery.